Okay, great. And Cyrus, so if there's a way that you can just let me know when we hit about 10 minutes left. Uh, uh, we have a lot to go through, but I want to make sure that we have some time to go over some questions.
Absolutely, you got it.
Okay, so it's great to see everyone. I'm glad that you're all able to attend this session. I think that we're going to learn a lot today, and I look forward to it. I'm really happy that you're able to attend this. So as it says here, this is the SMC COVID-19 awareness and safety training. So we're going to go over what is COVID-19, and a lot of this stuff, we've been doing this a year now. So I'm sure many of you can probably give this training at this point because this is all we talk about. This is all we hear on the news. It really warms my heart now that people know what PPE is. Most people know what N95s are. But these are things that my whole career, this is how I work. And now it's just household language that everybody knows. So I think that's great. So we'll go over what is the coronavirus and what happens if you get infected, what you should do if you are showing symptoms on campus. We'll go over one of the most important things, which is mindfulness related to safety, and then dig a little deeper into how do you protect yourself, how do you wear PPE, what are the various controls that we use to protect ourselves, and then how do we work with others moving forward. Okay, this is really going to be a foundation for you on the information that you need when we decide to bring people back to campus. So this is the initial foundation, the information that you will need coming back. And then once you have this, you'll know what I know, and you're able to apply it in the areas that you work in. So we're all kind of on the same page. That's sort of the whole purpose of this. Okay, so why don't we just dig right in? All right, so COVID-19, it's a coronavirus, and there's a lot of different coronaviruses. We're all familiar with the common cold, right? That is a coronavirus, and there's many other types of coronaviruses that cause many other types of illnesses. Of course, COVID-19 is one that came up in 2019, and it affects both the upper and lower respiratory tract, right? So we do see symptoms where you can have a stuffy nose or a runny nose or a cough, but then there are instances where we see it going deeper into the lungs, and that's where there are breathing issues and pneumonia and pulmonary edema. So as far as transmission is mainly person to person. And then there's the main transmission is through close contact, and that's important, right? So we've always heard close contact. What exactly does that mean? Well, that means that you're within 6 feet of another person. So 6 feet is the minimum distance that you have to be away from people. So close contact would be within 6 feet for at least 15 minutes, okay? So that's why we focus so much on our healthcare and on our nursing population because they do that sort of thing. They have to go and actually be within that 6 foot period, and oftentimes for an extended period of time. The transmission is through respiratory droplets. So when we speak, when we breathe, if we cough or sneeze, all these droplet nuclei just get spread out, right? So those droplets get spread out, and then they can hover around in the air for a little bit, and maybe you walk through it and you can get it on your clothes or actually breathe it in, right? So then depending on how much you've breathed in and whatever the dose is, there's a potential that there was an infection. One of the hardest parts, though, that makes this a little more difficult to control is some people who are infectious are not showing symptoms. Usually you can be infectious for about 72 hours without showing any symptoms. So at that point, you don't necessarily know who has it and who doesn't. So in that world, especially when it comes to working with microbiological contamination, you want to use what's called universal precautions. And a universal precaution means that you treat everybody as if they are infected. Okay, so any person that you come in contact with, you just say, okay, we have to stay at least a minimum of 6 feet away from each other. I don't know if you have it or not. You look perfectly healthy, but we're just going to be careful. That is universal precautions. One of the areas that gets a little confusing, and I'm not sure if the news makes this a little more confusing or not, but the virus doesn't jump off of surfaces. So they say that you can get it through droplet nuclei through the air or through surfaces. What they mean is if it's on a surface and then you touch the virus that's on the surface, let's say you touch a door handle or a table or a book or your phone, and it's on there, and then from there you touch your eyes, your nose, your mouth. That's how you're getting infected. It's a cross-contamination. It's going from one object to another object by cross-contamination. Okay, so that's why it's so important. We always say, don't touch your eyes, don't touch your nose, don't touch your face, because that's how it's getting transmitted oftentimes as well. All right, so also want to watch for symptoms. And if you're an individual that's been on campus over this past year, you know that there are a symptom checklist that you do every day because you're supposed to be watching for symptoms. Something that I do every day, as soon as I wake up, I go and take my thermometer and I'll check my temperature. Okay, it's a good indicator to see whether or not there is some sort of infection or something going on. But there's a lot of other things that we can look at as well. There could be fever, chills, cough, shortness of breath, difficulty breathing, fatigue, muscle aches, headache, new loss of taste or smell that's somewhat isolated to COVID-19, a sore throat, congestion, runny nose, nausea, vomiting, diarrhea, right? So it's confusing, right? Because for instance, I could call my doctor and they'll go through a whole list of symptoms with me and they'll say something like, have you had a headache? And well, I have a headache almost every day. That's just a part of life. Maybe I'm allergic to a lot of things. I always have a runny nose. So I think what it boils down to is this different than what you normally go through every day? Is this something that is unusual and maybe you're starting to have symptoms? Symptoms may appear between 2 and 14 days after the exposure of the virus. So anytime within that range, there could be you could be asymptomatic and then all of a sudden symptoms pop up on the 13th day. Okay, so just be aware of your symptoms. You want to watch your symptoms and make this a mindful thing every day. But what do you do if you have symptoms? Well, first and foremost, you stay home. Okay, you would not come to work if you had any sort of symptoms. You're going to want to contact your healthcare provider and then contact your supervisor. Okay, by contacting your supervisor at that point, that will initiate a bunch of steps that we go through for contact tracing if there was a point that you were on campus within the last 14 days. Okay, so it's our way to figure out who were you around, who else might be infected. We just need to know these things so we can let others know, hey, we've had a case on campus, and you might want to just look at your symptoms as well, get yourself tested, get yourself checked out, and just try to be conservative and safe, right? So number one, stay home, contact your health care provider, and then contact your supervisor. Okay, if you are at home though, it is important. That's where the main mode of transmission usually occurs. Try to stay in an area away from others and isolate yourself even at home if you can. And then if you have to go into the kitchen or walk around in the house for whatever reason, wear a mask so you're not infecting others. Okay, and then lastly here, look for emergency warning signs. These could be signs that say, okay, I need to call my doctor and potentially I need to go into the emergency room as soon as possible. So if you're having trouble breathing, you're having any sort of persistent pain or pressure in your chest, some new confusion, sometimes people get a little confused or dizzy, inability to wake or stay awake, or bluish lips in the face, okay? Those could be emergency signs, and you should call your doctor immediately and talk to them on what the next steps would be for your treatment. Okay, mindfulness. So this is the most important slide in the presentation, and I'm hoping that this makes the biggest impact on all of you, because this is really the key to maintaining a safe environment on our campus. Okay, of course, we're going to have a lot of controls in place. There's going to be things in place that are just there and they do what they're supposed to do, and they're there to provide safety for you. But at the end of the day, it really comes down to you and how you approach your work and your work environment and interacting with others. I'm sure over the last year, many of you have had to go outside. And when you go outside, what are you thinking? I need to take my face covering, right? You're being mindful of those things. Hopefully some of those have become habit at this point. Or you go to the grocery store. For me, at least, when I'm in the grocery store, I am constantly looking around, who's around me, who's behind me, who's in front of me, how close am I to the person next to me, what am I touching, how often when was the last time I put sanitizer on my hands, those sorts of things. Okay, I'm mindful of every step that I'm taking, and that's the level of mindfulness we need now at the college when we are doing our work. So for instance, if you are going to be starting to do something where you need to get up out of your desk and walk into a public area, you should be thinking first all the things that you need to be considering before you walk into that area. Do I have my face covering on? Where am I going? Is there any sanitizer there? What am I doing while I'm there? How do I communicate with others? And then when you have that all set and you feel, okay, this is safe and I'm ready to go, then you have set yourself up in a mentality of mindfulness, ready to go and perform what you need to do in a safe manner. And this goes with anything. This is not something new that I have brought up just because of COVID-19. This is something that I train in no matter who I'm training related to safety. Safety always comes down to thinking about what you're going to do before you do it and how to stay safe before you do it. And that puts you into that frame of mind, and then you can move forward and you're much more likely to be safe in the process that you're about to do. Lastly, along these lines, I always tell this story where when I was a kid, getting into a vehicle and going for a drive, there was no law, there was no seatbelt law, right? There was no nothing that said you had to wear a seatbelt, and most of us didn't wear seatbelts. But then the seatbelt law kicked in, and I remember thinking to myself, this is not fun. I don't like this. Okay, you have to reach over and pull it over. It's a whole nother step that you have to do. And then, it's across your body and it's sort of choking me. And I didn't like any of the experience involved in it, but it was the law now and I had to do it. I would say within a short period of time, maybe a couple weeks to a month, after doing that, if there was a point after learning that process and becoming habit, if there was a point where I wasn't wearing a seatbelt, from that point forward, I felt like sort of unsafe. Like, okay, I think I need the seatbelt. I feel much more safe with the seatbelt, and I'm much more comfortable driving with the seatbelt on, knowing that it's protecting me. So there was a process that I went through, and that's the process we all have to go through now to just make this from something that is, we're mindful, we're thinking about it, and then it finally becomes part of just what we do, part of our DNA, part of, it becomes a habit, okay? And that's our goal. We want all of these things to become habit, thinking all the time, just like the seatbelt. And eventually you'll walk out of your cubicle and go, oh, I forgot my face covering. I know I need to have that. And that's just a knee-jerk reaction. You knew you needed it and you go get it and you put it on, okay? So that's how important mindfulness is. And that's why I spend so much time talking about this. Okay, so now safety control. I feel that it's important for us to go over these safety controls because this is what I do when I analyze areas to see what do we need to put in place and how do we keep things safe. And this is not just COVID, this is any sort of situation. So what you look at is engineering controls, administrative controls, and personal protective equipment. Okay, an engineering control is something that is engineered in the space. For instance, let's you walk into a restaurant, fast food place, and you see plexiglass in front of the counter. That's an engineering control. They installed the plexiglass, they engineered it in as a control. It stays there, doesn't do anything else but protect the person, and it just does what it does. It's not going to move around. It's not going to change. It's there to do what it's supposed to do. That is an engineering control. Administrative controls are where we're able to administratively see how we work together. So that's why we've been home for so long, right? That's an administrative control. We said, we don't want people on campus right now. That might be a little unsafe. So let's have everyone work from home, and everyone will be separate, but we'll still be able to get the work done. Another example of that is staggered shifts. So let's say some people come in Monday, Wednesday, other people come in on Tuesday and Thursday, and we're able to have space within our areas, okay, staggering shifts. Another administrative control, you know, or lastly, if we put a sign on the kitchenette that says only 2 people allowed in the kitchenette at once, then you can only have 2 people in there. That would be an administrative control, okay? And then finally, personal protective equipment. I think we all know what that is at this point. It's the gloves, the gowns, the face shields. I do want to make one distinction, and we'll be going into this in a second. The face covering, people often call that personal protective equipment. And I guess we could interchange that word, but really the face covering is there to cover your face so you are protecting others around you. It's really there to protect others when you're breathing or when you're sneezing or coughing, so the droplet nuclei stay within the face covering. That's what it's there to do. It's not necessarily there to protect you from breathing in the environment, okay? So it's technically not a piece of personal protective equipment, but it does protect the environment, and it protects it very, very well. And it's something that we all need to wear. Okay, so key prevention practices. So these are the 4 things that we're really focusing on a lot right now, okay? Number 1, physical distancing, you know, and there's more details that we can go into, but if you can remember these 4 things, then we're 95% of the way there, okay? Physical distancing, we all know, is 6 feet, at least 6 feet. Remember, 6 feet is a minimum. So if we can be more than 6 feet, that's even better, but we have to be at least 6 feet from others. Using face coverings, like I had said, putting the face covering and properly wearing it. Frequent hand washing and regular cleaning and disinfection of multi-use tools. Wiping down surfaces, washing your hands regularly, using sanitizer on your hands, being mindful that, let's say there is a multi-use tool, which would be, let's say, a stapler. You pick up the stapler and you use it, now sanitize it. Make sure it's wiped down so the next person that picks it up is not cross-contaminating and getting anything on their hands. And then finally, being mindful of the limiting the surfaces touched, right? So just think about all the areas that you're touching with your hands. Whenever I go through doorways, I usually try to use my sleeves or my shirt or a tissue or something else to grab the handle. Okay, so I'm not actually grabbing the handle, and I'm not getting it on my hands. Okay, I'm always thinking about that. So the more you think that way, try to just limit your bare hand contact on surfaces. But if you do have to touch things, obviously you do, be mindful not to touch your face, as we discussed earlier. Okay, so wearing your face covering correctly. And I think most of us do this very, very well, but I'm sure most of us also have stories of seeing people that don't do it very well, right? Um, anyone who's been in a supermarket or out in public, I'm sure you've seen people that put on the face covering, but they don't cover the nose, right? Or they put on the face covering and it's just under the chin for some reason. Not sure what's going on with that. Or they're wearing the face covering properly, but when they decide to talk, they'll pull it away for a second and talk and then put it back, right? We've all seen these things. So we don't want to do any of those things. The face covering just stays on. We talk through it, and it has to be completely over your nose, completely over your mouth, and secured under your chin, right? And try to get it tight on both sides if you can. So when you're wearing it, first you want to wash your hands. Make sure you wash your hands whenever you're putting on your personal protective equipment. And the reason for that is you don't want to necessarily contaminate your face covering, right? So you wash your hands, then like I said, you put it over nose, mouth, and chin. Try to fit it snugly around your face, and make sure you can easily breathe, which is a good point because we are having to breathe through something now, and it's harder to breathe. The respiration process is a little more difficult, so make sure that you're always replenishing your fluids. Drink lots of water because it is taxing on your body to have to breathe through something, and you'll become dehydrated, so you want to replenish your fluids. So like I said, you're going to be using the face covering to help protect others, right? So wear the face covering to protect others in case you're infected, but you don't have symptoms. The face covering prevents all the droplet nuclei from coming out. It gets trapped inside the face covering. Keep the covering on your face the entire time you're in public. Don't put the covering around your neck or your forehead, and don't touch your face, right? Things that we just covered. All right, and then taking off the face covering, you're gonna, if there are strings in the back, you always wanna go from the back, because as you're going through life, you're sort of going forward through life, so the front of the face covering will be contaminated. The back is less likely to be contaminated, so you would pull it off from the back, hold it by the straps from the back, okay? Place the face covering in a washing machine if you can, or just try to wash it or sanitize it, and then make sure that you wash your hands with soap and water. Okay, now glove use. We're all going to be wearing gloves at one point or another, because when you're using sanitizer, you're sanitizing your areas, you need to be wearing gloves. So the CDC recommends wearing gloves when you're cleaning or caring for someone who's sick. The gloves will be used when interacting with the public. Gloves are not a substitute for washing your hands. So just because you're wearing gloves, you shouldn't have a false sense of security that your hands are not dirty. Okay, you're gonna have to wash your hands before putting on the gloves. And then you wash your hands when you take the gloves off as well. And we'll go through that process. And then after you wash your hands, before you put on the gloves, inspect the gloves. So you wash your hands, you grab a pair of gloves, you look for holes or tears, make sure they're in good condition, they're not soiled in any sort of way, and then once they look like they're new and in good condition, then put them on, use them as needed, and then when you take them off, you go wash your hands. Okay, so removing gloves. What we're going to do right now is I'm going to show you a video of someone taking off their personal protective equipment, and they're going to go over how to take off gloves properly. And it's basically these steps that are here in front of you, but I think it's probably easier to see it in a video. A lot of what I'm going to show you doesn't necessarily apply to everybody, but it's still a good idea of the mindfulness that you'll see this individual going through when they take off their personal protective equipment.
Hi, I'm Jessica, and I'm here at Dove Lewis, and I'm going to show you how to properly take off PPE according to the CDC. There are two examples that the CDC has on how to properly take off PPE. I'm going to show you example one first. In example one, we're going to start with taking our gloves off. So you will want to hold your palm out, carefully pinch your glove, and start to work the glove all the way down. remember that your glove and everything on the outside is considered contaminated. So you want to be careful not to touch your dirty glove to your clean hand that is slowly being exposed. So you're going to work this down and then pull your dirty glove off into your other hand. This is now your clean hand and dirty glove in dirty hand. If you accidentally touch any dirty part or contaminated part on you, make sure that you wash your hands and then or use a alcohol-based hand sanitizer. For the second glove removal, I've just exposed my clean cuff of my gown. I'm going to carefully slide my finger underneath into the clean part and then carefully work that off like that. Now my gloves are inside each other, turned inside out, inside each other, and into the garbage. Okay, next step is to remove your goggles or face shield. Remember that the front is considered contaminated, so I want to just take off the back and put these where they will be out of the way and able to be disinfected. Next will be our gown. So I'm going to very carefully pull the end of my string and undo my Velcro since this is clean in the back. Carefully slide this down. You can pull on your cuff because that was inside your dirty glove. Work this down. Turning it inside out is easier so that you're not accidentally touching the contaminated outside layer. Now I can bundle it up because the inside is considered clean and put that into the garbage. Next, you will want to remove your face mask. Again, be careful not to touch the front of it because that is considered contaminated. So we will just take off the back and not let it go flying around. Take that off and dispose of your face mask as well. Now I want to go and wash my hands or use an alcohol-based hand sanitizer. And that is how you properly take off PPE for example 1.
Okay, so I think the important thing there is all the mindfulness that you saw.
This is the checkers game where grandson and granddad will bond. This is the kitchen where the new boyfriend will unofficially
Gotta
become
love
family.
YouTube.
These are the Verbo vacation homes waiting for your
Commercial
family.
here. Let's see if I can.
Yeah,
close
commercials are
this.
terrible.
Writing's not that easy, but Grammarly can help. This sentence
Perfect.
Sorry about that.
Pardon us, folks.
There we go. Okay, so the important part of that was the mindfulness that you saw, the fact that when you're taking the gloves off, you're pulling from the palm. Here, I could show you the next screen. And this goes through the process where you're pulling from the palm with your dirty glove, pulling it inside out. So now the idea is the inside of the glove is clean. And then you grab it with the dirty glove. You have one glove inside the other. That's step 3. Step 4 is going underneath the cuff and pulling that inside out. So the glove that's in your hand is now inside that glove. Okay. And now you have only on step 6, the outside of the glove is showing. That's the clean part. And you have the original glove inside the first glove. Okay. Once you do this a couple times, it'll become second nature. It's very easy, but it's all about thinking about where the contamination is and how do we prevent it from getting it on our hands. And of course, you know, there might be a little contamination that gets on your hands, and that's fine. That's why we have sanitizer. That's why we have hand washing to take care of those types of things. And like I said, when you remove your gloves, sorry, I don't know why that just happened. When you remove your gloves, that there might be contamination. You're going to always have to wash your hands. Cyrus, do you not see the presentation at the moment?
I do. I think you need to go back into presentation mode because I think we just see it as a Teams app right now. So.
Okay, sorry about this, everyone.
I also do want to mention, while Daniel's working through the presentation itself, that for those that are attending us today, this actually is part of the component of the training that this is part of a component of a larger training that everybody at SMC is going to be required to take. So do note that by attending this session, you will receive 1 hour of the partial credit. That's part of the larger module that will be unveiled for everybody else for today's session. So we thank you again for reviewing this information, as it's very important information for all of us to return back to SMC safely. So without further ado, I'll actually turn it back over to Daniel. So.
Great, thanks, Iris. Okay, so this is where we are. Like I said, you're going to try to prevent contamination, but whenever you take off your gloves, make sure you wash your hands. Okay. So hand washing. Remember that when you're hand washing, and we're going to watch a couple videos. These are great videos that I think will enlighten a lot of us here. But you're going to want to wash your hands with soap and water, right? And then the idea here, again, it's mindfulness and cross-contamination. So let's say you walk into a restroom where you manually have to turn on the water. Okay, so your contaminated hand has touched the knob, you're manually turning on the water. So now that knob is contaminated. So you wash your hands properly, leave the water running, go get a paper towel, dry your hands off, and with the paper towel, turn off the water with the knob. So now it's the paper towel that's contaminated, not your hands, and you can throw away the paper towel, okay? So let me show you a couple videos here. The first video I'm going to show you is really great. It's an experiment that I did several years ago. I've done this experiment where we're going to put on some fluorescing gel that is supposed to simulate bacteria and put it under a UV light, and you'll see it all fluoresce. That's supposed to be bacteria on your hands. And then they show you various ways of how people wash their hands improperly, and then go back under the UV light, and you can see whether or not bacteria is still there. And then finally, you wash your hands properly for 20 seconds, doing all the correct motions and how it gets rid of all the bacteria. So looking forward to all of you seeing this video. This is really great. Okay, there you go. So you can see the hands are completely clean. The idea is to properly wash your hands for at least 20 seconds, and we'll go over that right now on another video. The 20 seconds, if you want to know a time frame, you can sing the ABCs, or you can sing Row, Row, Row Your Boat twice. And the 20 seconds is really the time that you're rubbing your hands together, lathering the soap, okay? Not getting your hands wet, not drying your hands. It's all about the 20 seconds of rubbing your hands together with the soap, okay? So this next video is going to show you all the proper steps to go through to make sure that you are washing all the areas on your hands and how to, the best, most efficient way to get that done.
Let's first put soap in the palm of our hands and then begin to rub in between like so. But as you see, there is no soap on the back of my hands, so I'm going to interlace my fingers palm to palm, and then I'm going to do the same technique on the back of my hands with each hand. And then you're going to take the back of your fingers to opposing palms with fingers interlocked. And then start rubbing your thumbs. And then you're going to take your fingertips, clasp the fingertips in the right hand in the left palm, and vice versa. Rub your wrist one last time to make sure your hands have been completely covered in soap. Thanks for watching.
Okay, so you can see all the different motions, the front of the palms, the back of the palms, lacing in between the fingers, the fingernails, the wrists, the thumbs. This is not how I've ever washed my hands until I learned how to do it. I'm sure most of us are probably like that, but this is what we have to do, right? To get all the bacteria off the hands and make sure the hands are thoroughly clean. This is how the restaurant industry is trained to wash their hands. And that's when I first saw this, when I was working in the restaurant industry. And it's very, very effective. Okay. So just going back to our slides. Okay, so as far as responsibilities, everything that we talked about today, I can't emphasize enough, be mindful of the safety protocols, okay? Be that person who is the example, right? Because this is something that is going to take all of us doing together. So all of us need to be the example, and you know, we have to be aware of the safety protocols. We have to be aware of what protocols are specific for the area that you're working in, and make sure that we're following those protocols. Be the safety officer for your team, okay? Everybody should be in this role. And I think that some of us maybe don't want to be in that role because it's difficult to tell people, hey, you know, you're not wearing your mask, please wear your mask properly, right? I think some of us maybe worry, you know, how is this person going to take it? Are they going to get upset? But think of it this way. If anyone is coming to me and saying, look, you should be wearing your mask properly, or, hey, you know, can we stay 6 feet away from each other, please? The way I look at that is this person is worried about me. This person cares about me and wants me to stay healthy. So that's what we all need to do for each other. And it's more of like we're taking care of each other, okay? We are looking out that, okay, let's make sure we're 6 feet apart, that we're wearing our masks. Has everything been sanitized properly? When you walk through your area and you look around, is the sanitizer where it should be? Are there supplies available to make sure that we can sanitize the items that we need? It's just those sorts of things. It's just an additional eyes from everybody looking around and making sure that we're staying safe and the protocols are in place and all the supplies that are supposed to be there are available, right? And then this goes into creating a team focus, right, of safety and wellness. We're all looking out for each other, and we're a team in this, okay? There's the old saying, it takes a village, right? That's where we're at. This is something that is going to take everybody to be a part of, because someone not wearing their mask properly could end up being a problem. So number one, we all look out for each other. And number two, we create this environment where we're open with each other. We can communicate about safety with each other. And we feel like we have a team. We're in this team with this goal of safety in our department. And we're all doing this together. Okay, and that means good open communication, being able to talk about the things that we're seeing and making sure that we have everything in place. Additionally, there are some additional resources from a wellness standpoint. You know, this is something that I just want to mention, that if we've been away for a long time, been at home for a long time, coming back is a different environment. So there is the Employee Assistance for Wellness and Managing Stress. And if you need some resources as far as stress and wellness, then I recommend reaching out to the Employee Assistance Service for Education, EASE. Okay, that's a resource that we have, and they'll be able to help you with wellness and managing stress. And just one last thing, I think that it's important for us to remember that mindfulness towards safety also goes towards making sure that our lives are balanced, even though we are in a stressful environment. So that we're eating well and we're getting enough rest and we're able to sort of deal with our stress. However you do that, go for a walk or meditate, maybe get a little bit of exercise. All of these things will help in the long run in boosting your immune system and just helping you feel better day to day. So with that said, I'd be happy to take any sort of questions at this time.
Great, thank you, Daniel. I'm actually going to pause the recording so that we don't